Good morning, and thank you all for coming here tonight. It's an honor to join this group of leaders to have an opportunity to talk about the innovative and equitable future of healthcare. And in particular, I'd like to focus a little bit on how we better prepare America for future public health threats. As we work our way through the ups and downs of this pandemic and we look at current events, like Dr. Gawande was mentioning about the monkeypox outbreak and the Marburg outbreak that we've heard of and seen so recently, it could be easy to focus our efforts on what was most recent. But unfortunately, preparedness doesn't work that way because public health threats don't actually work that way. Now is the time for action to make sure that America is prepared for the next public health threat. If we forget the lessons of the anthrax attack that happened just down the street over 20 years ago, or the other types of threats that we've faced since then, we might be prepared against one set of issues, but fail to address the more dangerous threats or the exposure from other concerns and leaves ourselves dangerously exposed. From deadly pathogens like anthrax and smallpox and Ebola to the opioid crisis, the U.S. government, particularly the Assistant Secretary for Preparedness and Response and BARDA, since their inception, and other agencies like the Department of Defense and the National Institutes for Health, have been there to really help drive the response. Since our inception, over 20 years ago, Emergent has been focused as its mission on really driving forward solutions to public health threats with these U.S. government agencies and others across the world to prepare for an ever-increasing set of risks that are both known and unknown. When it comes to the last 3 years, we've seen the real benefits as a society of public-private partnerships as well as scientific collaboration. We've learned what works and, critically, what doesn't work and where we can do better. Making these types of relationships work really takes a lot of communication, trust, clarity, and above all, certainty. We need to continue to amplify and expand upon those things that have actually worked and take a look at those things that we learned in the pandemic didn't work and rethink them. Above all, we've learned how important it is to be prepared for almost anything, even the unimaginable. Real-world events remind us that public health threats can emerge at any time, and so the question that we need to ask ourselves are, how can we better protect and enhance life to create a better and safer future for all? Through these many years of collaboration with the U.S. government, we've learned a great deal, including what's worked and what hasn't, and how we put America on a stronger footing for the next public health threat, whether it's accidental, intentional, or naturally occurring. Even in the most polarizing times, preparedness has not historically been a partisan issue. And so it's not surprising that we've started to see the emergence of real, true bipartisan leadership as we come out of the pandemic. For example, the Biden administration has proposed a $65 billion initiative to enhance America's preparedness efforts with an increase in the medical countermeasures that are in the Strategic National Stockpile. Second, as you'll hear from Dr. Disbrow, I'm sure, in a few minutes, BARDA has laid out a strategic plan that really sets America up for preparedness for the next pandemic. And third, Senators Patty Murray and Richard Burr have put forward the PREVENT Act in a bipartisan way, which really helps drive future infrastructure of the United States, making sure that we're prepared for the next set of attacks. We know from experience that the best preparedness plans come from debate around what's worked and what hasn't. And regardless of the details of what's agreed upon or not, what's really critical is that we need to have a unified biodefense budget to face the challenges that come next. Critically, this has to be sustainable. This cannot be a one-and-done effort. This is something that is continuous and ongoing. Prioritizing preparedness requires 4 important things. The first, and this builds upon what Dr. Gawande was saying, there has to be a trained and skilled workforce. We oftentimes think of first-line healthcare workers as those people who are in the hospitals, but manufacturing systems and R&D systems are absolutely critical in the middle of the pandemic, and making sure that there's a trained and skilled workforce that's ready and prepared to go in terms of responsiveness is absolutely critical. The second is expanded investments in research and development. As we saw with new technologies being brought forward, we have to make sure that we've got new, different solutions for each unique type of threat that is actually going to come up. Third, we need to be building and regularly exercising our manufacturing capability and capacity. This isn't something that you can easily ramp up in the middle of the pandemic. It has to be used for regular production of real-world products and the potential to adjust when the need arises. And then the fourth thing is really making sure that there is an appropriate supply chain for the medical countermeasures that are in the strategic national stockpile, including all the materials that are necessary to actually produce those products. A sustained commitment must also be coupled with careful, responsible communication based on science that instills confidence in America's response. And this is everyone's responsibility, everybody that's involved in the responsiveness. Successfully combating the next public health threat requires reliance that Americans are trusting the tools and the communications that are coming from the government in order to respond effectively. There were many near miraculous things that happened during the course of this pandemic. Chief among them was the development of novel vaccines and therapeutics that were effectively developed, tested, and made available so quickly to the public. But history, along with current events such as the monkeypox and Marburg outbreaks, as well as the Russian threat or the Russian war in the Ukraine, reminds us that we rarely have the luxury of responding to a single threat at a time. We know that individual threats can continue to evolve, and we may be dealing with multiple threats at the same time. As the adage goes, you can't fight tomorrow's war with yesterday's army. It's clear that America is better positioned to meet the threats now because of the steps that we've taken together, but we still have a ways to go before we're completely prepared for the range of public health threats that are on the horizon. I look forward to hearing more from the other panelists that come up today, and thank everyone here for coming to discuss ideas and really figure out how we create a safer, healthier world where peace of mind prevails. Thank you very much.